Hey Celia, what is ASD?
ASD? Oh, you mean autism spectrum disorder? Well, ASD is basically an umbrella term to refer to developmental disabilities caused by differences in the brain. It covers four disorders: autism, Asperger's syndrome, PDD, and childhood dysregulative disorder.
Oh, are the people with these disabilities similar?
No, they're very different. These disorders can be ranked according to their level of functioning, Asperger's syndrome being considered as the mildest one. People with Asperger's syndrome will be more likely to have an average or higher IQ but poor social life. People with PDD, also called pervasive development disorder, are characterized by severe to mild impairments in areas of social interaction skills, communication skills, and presence of stereotype behavior, interests, and activities. People with autism will have similar symptoms but more pronounced. The last one, childhood dysregulative disorder, is the rarest of them all, and it describes children who develop normally and then quickly lose many social, language, and mental skills, usually between age 2 and 4.
Wow, that's a lot of information. But how do people contract ASD?
They do not actually. The cause for autism is not clear yet. The only thing we know is that ASD is congenital, meaning it happens before birth.
I see. Are there any risks that can favorize or reduce the probability to have ASD?
Yes, there are. For example, older parents will have a higher chance to have a child with ASD, but taking folic acid vitamins prior and during pregnancy can help to reduce that risk.
Oh, I have another question. How does ASD affect the body?
Well, studies have shown autistic children can have varying degrees of difficulty with fine and gross motor skills. Gross motor skills refer to balance, body awareness, and motor control, while fine motor skills may include anything that relies on using small muscle in the hand, such as cutting paper. Another study could suggest autistic children could be 6 months behind in gross motor skills compared to their peers and a year behind in fine motor skills. But wait, Jinsung, why do we have to know about learning characteristics and teaching strategies for ASD?
People with ASD can have special difficulties when it comes to education. They tend to lack of appropriate eye contact and have difficulties following directions. They have an inability to initiate or respond to joint attention and have a delayed vocabulary development, so it is difficult for them to understand abstract concepts. They are also unable to screen out irrelevant information and have difficulties in interpreting social language, such as sarcasm and jokes. To make it easier for them, there are some teaching strategies. The main one is to kiss.
Kiss?
It stands for keep it short and simple. We also need to use visual cues and be patient with them. They need to take a break often as well, and we must go for clear explanations.
That's interesting. And are there any behavioral issues that people with ASD have?
Yes. First thing is stimming. People with ASD have stimming issues such as shivering their legs or hitting their own head. This kind of acting is for self-stimulation, which makes them comfortable when they do it. Second thing is focused on or attached to unusual objects. People with ASD tend to focus on the things that are unusual and obsessed about it. It can be a real problem because it might cause serious accident when they focus too much on following things they are attached to.
I see. I got another question. Then how do we treat someone with ASD?
That's a really nice question. First, you must ask them first. Although you have a good intention to help person with ASD, he or she might not want your help. So when you're trying to help or treat someone with ASD, please, please ask them first.
Ask them first. Okay, I'll keep that in mind. What else?
The second point might sound obvious, but just treat them like the same person. People with ASD might seem to be a little different, but they are the same as us. So it is important not to treat them in a special manner. Most of the people without disability treat people with disability differently, but that's not a good for both parts.
Okay, thanks. Now I understand better.